Thank you, Caitlin. So what I will do is I will just give a broad overview over the concepts associated with outbreak management, and actually goes beyond the outbreaks, really into how you plan for dealing with African swine fever. I think it's useful to do that, and we'll have later on various much more specific presentations in relation to country experiences. So the first thing, okay. So what I'm doing is, and this is not meaning to say that the FAO is the only organization that has, I guess, some guidelines on how to plan, but I think, and so do several others, it's probably not a bad way to start. So they've produced what they call the Good Emergency Management Practice Manual, which I think quite neatly characterizes the way how we need to plan for such emergencies. So we've got the prevention, we've got detection, response, and recovery. And I think what we find quite often is that countries may just focus on, say, the detection and the response element, instead of also recognizing how those four phases or components of disease management interact with each other. So if we take prevention, I mean, prevention is really is what we want. I mean, this is what we should be aiming for. And the key element with respect to African swine fever is that we need to have enhanced biosecurity. There are issues in relation to the structure of the pig industry. The pig swill management, feeding management is something you need to consider. And also, depending on what region you are, you need to consider wild boar and also maybe ticks as a vector for the infection, for disease spread. Now, as part of that, you should have an effective surveillance system and some quarantine measures, which may be useful or important for when it comes to bringing meat or live animals in from other countries that may be at risk of infection. And then you need to have some policies in relation to zoning, and maybe even with respect to compartments, which is something that we're working on at the moment, but specifically for African swine fever. Detection is often, and we've had in previous sessions of the SGE, we've talked about those issues, surveillance systems for early detection. That is a key and essential element of preparedness. And what often, I guess, in the heat of the action gets underestimated is the relevance of sound, structured epidemiological outbreak investigations, which will then inform the response that we are aiming for once we've confirmed the outbreak and described what the cause was, where it came from, and how we can actually stop it from spreading further. So that's where tracing is important. We've got, I think, need to think about policies that are appropriate for dealing with the goals that we have in mind with our response strategy. And in fact, that's a very important issue. Be clear about what you want to do. Do you want to eradicate the virus? Do you want to minimize the spread of the infection? And so it's, and in fact, that's probably one of the things to decide on early on. We've had discussions on the complexity or the issues associated with culling and destruction of large numbers of pigs, which most of the policies were based on that being the first step that countries used, and then they were very quickly overwhelmed by the amount of carcasses they had to deal with and how to dispose of them. Effective contamination. Decontamination is important and shouldn't be forgotten. And it's not that straightforward to do that in a sound way to prevent reinfection when you are restocking. So that's where the final phase, the recovery phase, which is the one that often is being forgotten. So if you have dealt with the outbreak, what are you going to do in terms of putting stock back onto the farms, or other farm businesses changing their priorities and shifting to something else? And how are you going to deal with it? So that's those four areas which I think it is, not just I think, I mean, it's very important to see them together. Okay, so here I've got them again. And I just wanted to point out the importance of risk assessment at the center of it. Yes, the risk assessment here. which is so the capacity in the team to be able to perform sound risk assessments is absolutely essential, because that will inform your prevention measures, your detection, your response, and also your recovery. For the detection end, we have to have effective surveillance for early detection, and the focus being there on early detection. With this disease, if it takes you too long, it will have run away by the time you've detected it. And that needs to be then combined with structured outbreak investigations. Okay, it's just, oh, what's it doing? It's doing its own thing now. Risk assessment Roi, so I just want to have one slide quickly. What this is about is identifying risks and quantifying them, and also what I think is maybe is as important, or maybe the most important element, is identifying the pathways. How does it get in? What are the key ways for the disease to come into your country? And I guess this thing about acceptability, I guess we're assuming that that is with yeah, I mean, there may be some pathways where you're deciding that the risk is actually sufficiently low that it is acceptable, and therefore you do not have to implement a risk mitigation strategy. So that once you've done that, you can come up with some policies that target, from a surveillance perspective and early detection perspective, the way how you hopefully will be able to prevent and also ideally very quickly detect the disease. And that understanding also helps you in being more effective in your response. And the way how we look at the risk assessment is by applying the YE risk analysis framework, which I think has been tried and tested for whatever now, I think 30, 40 years around the world. So it's useful to have capacity in the team in these methodologies. Okay, so now this is my, and people who have attended previous meetings have seen this slide before, but I think we should keep showing it, because the crux of the matter with African swine fever is this complexity of the pork food systems that we're dealing with in these countries. I mean, in your countries.
Are you able to zoom? Are you able to zoom in on your presentation? Just, I think it's a bit small. Maybe if it's, can you make the slides larger?
Oopsie, oopsie. It is full screen on my. Let me see whether I can. What can I do?
I don't think you can zoom, because you look up the upper of the screen, view option, and you can window here.
There's annotate, security, stop video. We don't want to do that. Control.
Or actually, Caitlin, each of us can also manage our own screen. If it's too small for anyone, you have view options that you can enlarge your own screen.
Yeah. If you move the mouse, you can then see the green line at the top, and it says view options.
Yeah, because I can't. I mean, if I start fiddling with the.
Okay, that's fine.
No,
if you request it. Yeah.
Yeah, what I mean is that individual participants can manage their own screen. You don't need to change it.
Okay, so I'll keep going, right?
Yes, sorry.
No, that's, I mean, it's important that you tell me. But I mean, this is, so it's not so much about you seeing the detail here. I just want you to appreciate the complexity and how that will, each country will have different structures, and you need to be aware of them. And they are changing. I mean, now with mobility, I mean, the volatility or the changes in the pork price, the industries are changing in different countries at a different pace in response to the African swine fever situation. So as a response to the occurrence of the disease, but also as a response to pork prices. So when we are designing our surveillance programs, we need to have a pretty good feel for what the dynamics are with respect to industry structure. And it is not just about farms. It is about and I'll show you that. I'll remind you of that in my next couple of slides. So that is the background, and don't forget the dead pigs either, okay? Because I mean, in many places they become another commodity that is then going back into the system in some way. Okay, now this is just a list of risk or mechanisms how the disease can actually spread, and there's nothing. I mean, you're aware of it, but it's important to be reminded and realize that you will have, depending on the country that you're in and the system that you have, there will be a different, I guess, priority listing. That you need to be able to work out what it is. And it may well be dynamic, like I said, it may change over time. So your experts need to look at the industry and how the risks change over time. And then we've got obviously the wild boar question, which in this part of the world here, I mean, we don't know enough about, apart from maybe, not just maybe, South Korea has had extensive experience with African swine fever in wild boar, and I think we need to hear from them, and we also all need to learn from them how to deal with this disease, how to conduct surveillance within wild boar populations, and how to manage the disease risk for pig farms. But obviously, there's been a lot of work has occurred or has been done in Europe in relation to the wild boar African swine fever problem that we'll hear about later. Okay, so when you take all that, you could think about your risk pathways, and again, like they are individual. You've got your pig farm. How does it get onto the farms? I mean, one mechanism is from a neighboring country, maybe like pigs that you're bringing in for breeding reasons. Okay. It may be that you have local pig, and not maybe, you will have local trade. What about the vehicles that are moving around? What about the feed trucks? I mean, they all have potential visitors for taking the virus onto a farm. We've got the role of the slaughterhouse. I mean, pig trucks, pig transport trucks going to slaughterhouses, they're very important. And we know that from China in particular, and it'll be the same in other countries. The incredible importance that they have for having the potential to spread the virus around by taking infected pigs, asymptomatic probably, to a slaughterhouse and then going to another farm, not having been cleaned properly, etc. And it's not that easy to clean a truck effectively. And then we've got that whole thing of meat marketing and so on. And finally, we've got the wild boar. So when you look at all that, it's a horrendous task to work out what are the priority areas, what are the highest risk the pathways with the highest risk within your situation. So you need to really examine this in some detail and then decide how you best manage the risk. Okay, so by knowing that, you should think about what are the best surveillance components. And now what I've done here is I've just gave you. You've got lots of options. It's like a toolbox. Like you can, wild boar, we conduct surveys, we conduct carcass examinations, we can work with hunters, etc. So there are different ways of assessing what the status of the population is, what the prevalence is. Rarely do we get the opportunity to do sort of epidemiological surveys. It's usually based on people finding carcasses, and I mean, if we're lucky, they're giving the authorities access to them to perform diagnostics. We've got a lot more possibilities at the domestic side and pig side, so let me just move through that quickly. Don't forget about using just increases in pig mortality as an indicator of introduction of African swine fever. Slaughterhouses, pre-mortem inspection is important. Border inspection, of course, when you talk. And finally, the most important one, as always, remains passive reporting. We need to have farmers, veterinarians, and also other stakeholders, traders, truck drivers, etc., report to the authorities that have had some cases. So on the basis of that, what you need, you think about, you can kind of afford all those components, look at what's optimal for your particular situation. So maybe border inspection you will have probably. Farmer reporting is always key, how to incentivize them to report, how you compensate them for in case of any outbreaks, and how much and how quickly does that happen. Pre-mortem inspection at slaughterhouses does work, it's important, it's a useful tool, it needs to be done properly. Farm surveys, probably, I mean, it's unlikely that people will be able to do that. Wild boar carcass examination is what we need to encourage, but we need to find ways of encouraging or incentivizing hunters to provide us with the carcasses. And there is good information examples from South Korea, but also from Europe in this respect. And finally, monitor pig mortality. When that goes up suddenly by a large amount, that should raise an alert. A simpler system is just using border inspection, farmer reporting, slaughterhouse, pre-mortem inspection, wild boar carcasses. So you can, it's mix and match depending on what you're able to do in your country and what you consider to be the most important pathways. So once you've detected an outbreak, there's the first phase is the suspicion phase, when you don't know, you haven't confirmed it yet via the lab, and you need to define the location, whether that's a farm, and it's not always a farm, it can well be a slaughterhouse or some other place, a market area, for example. You may want to establish temporary zones where you don't allow movements of livestock, of pigs anymore. You start the diagnostic project and process, and then you need to start your epidemiological outbreak investigation so that you're beginning to get an understanding of what's actually going on. And then don't forget about the importance of communication with stakeholders during that process. Once it's confirmed, then you get into the get really stuck in the epidemiological outbreak investigation in relation to the source of the infection, and it needs to be done in a structured way. Don't rush in there and just cull and remove the pigs. You need to get some evidence so that you can work out where it came from and where it has gone to. We see so often where people are going in and culling and do forget or omit to collect information that allows them to decide what they need to do next in order to stop the spread of the infection. You may want to establish surveillance zones or protection zones around the outbreak, and that obviously has implication with respect to finances, etc. And then lastly, or actually not lastly, the last thing is the communication, including notification of the IE if necessary, and the control policies, of course, which depend on the situation that you're in, but you've got a lot of options there and need to be such that they do not disincentivize your stakeholders from contributing to the control program. Okay, and there's some various resources, and I don't want to, so I'm advertising for FAO here. There are several documents which you can download, but there are also other, obviously the OIE has also information about how to deal with African swine fever, and we are at the moment for OIE working on some guidelines for establishing compartments for pig farms that would hopefully allow them to continue business in the case of an outbreak of African swine fever in a particular territory. But they will come out in the next 2 to 3 months, hopefully. Okay, yeah, and biosecurity. Everything is about biosecurity, and I think we need to convince our farmers that that's actually of benefit to them, not just to protect them against African swine fever, but also any other infectious diseases that actually have an adverse impact on their production. Final slide. Think about the whole story. See, don't just think about outbreak investigations or setting up surveillance. Think about the whole package, the whole program, emergency response program, good emergency management program, which includes prevention, detection, response, and recovery. They all hang together. One informs the other. Early detection is key, and I might show it at one of the next meetings, a model that we've developed that demonstrates, shows you how easy it is to miss this disease, because it takes a while for the farmer to actually see increased mortality. And by that time, the infection will have been on the farm for some time. It will have infected other animals, and animals may have moved off the farm. Products, pigs have been slaughtered that were infected. People may have contaminated their clothes and shoes and their vehicles, etc., and taken the virus to other locations. So this is a very difficult, and it's definitely more slowly moving forward than on land, foot and mouth disease. And we need to always prevent exposure of wild pigs, because once it gets into wild pigs, it'll be very difficult to, to control the disease, as we know from Europe, and we also, as we know from South Korea. epidemiological outbreak investigation, I can't emphasize that enough. It needs to be done in a structured way, that you have forms and questions, and ensure that there's no step missing in there in terms of identifying sources, onward spread, contexts to inform the tracing. And finally, of course, you need to, for all of this, you need to have decided why you're doing it. What is it that you're trying to achieve? And we know from previous SGEs that there is a big issue with respect to large-scale culling, because that makes it very difficult to maintain support from the stakeholders. And I'll stop there. Thank you very much.